Chapter 46, Nursing Care of the Child with Alteration in Cellular Regulation, Hematologic or Neoplastic Disorder. In this chapter, we're going to talk about a few of the hematologic disorders that affect the children. We're going to talk about some assessment and priorities with interventions. We're going to talk about some resources, talk a little bit about some of the childhood and adult cancers, or compare them. We're going to talk about some lab tests, but not much of that, and types of cancer, some interventions, and psychological impact. So just a review of the hematologic system. The erythrocytes, the red blood cells, are responsible for transporting nutrients and oxygen. Thrombocytes or platelets are responsible for clotting, so we're going to talk about a couple clotting disorders today. And then leukocytes are the white blood cells responsible for fighting infection, and then it breaks it down into the granulocytes. The white blood cells, we're going to talk a little bit about blasts, which are immature white blood cells. So when we think about cancer in kids, typically what I've seen over the last few years is when a child's diagnosed with cancer, the diagnosis, the staging, so trying to figure out what stage, how much that's progressed, that type of cancer, and the treatment happens in a short period of time, where it seems like in the adult, as an adult, that process takes a little bit longer. But remember, it all goes back to that, the earlier that you intervene, the better the outcome. So they differ a little bit because pediatric cancers typically arise from the embryo, so embryonal, especially in cases of leukemias, lymphomas, sarcomas, and CNS tumors. And then adults can usually arise from epithelial cells. Some of the common ones we see in kids, like I mentioned, leukemia, CNS tumors, lymphoma, neuroblastoma, rhabdosarcoma, and then we talk about some of the other ones, Wilms tumors, osteosarcomas, and retinoblastomas. In children, the warning signs are most often related to that blood cell production, and so sometimes the signs and symptoms can mimic other things like fatigue, pallor, frequent infections, bruising we talk about with leukemia, and then there can also be some bone and abdominal pain with the pressure of a tumor. So we're going to talk about the cancers later in the chapter. That's just mentioning right there about how they differ in adults. But we're going to talk about some other problems we see with the blood system. And the first one that we're going to talk about is anemia. So anemia is which the levels of the red blood cells and hemoglobin are lower than they should be. And so most often, certain types of anemia are caused by iron deficiency. The infant gets some of their iron stores from the mother, but they typically have some type of anemia early on in when they're born, and that can be in relation to the mother's nutrition. So that health history on the mother is always important. If she had anemia during pregnancy, then often the child will, or the kids who drink cow's milk only, because that has no iron in it. So basically, just fortifying things that are iron based. We're going to talk a little bit about some other types of anemia. So foods rich in iron are the red meats, tuna, salmon. Sometimes we see preschoolers, toddlers with iron deficiency anemia based on food choices. These lists of foods here are not typically the ones that toddlers like to eat, so it's really important for the parents to get them in, hiding them in different types of foods, things like that. Lead poisoning. So unfortunately, we're still seeing lead poisoning, even though you think about lead-based paints, and those haven't been around for years. But a lot of kids have problems with lead poisoning, and it does can affect toxically affect their bone marrow, nervous system, kidneys, things like that. They can. It's linked also to anemias. So the lower levels of lead poisoning, you might see some behavioral problems, such as some changes in their cognition, some learning difficulties. And then the higher levels are going to have some kind of encephalopathy, seizures, and brain damage. So really important to address that. So paint in the homes that were built before 1978 can cause lead poisoning. Dust from window seals, walls, plaster in older homes, especially if they're doing some remodeling, things like that. Soil, where the cars used leaded gas and had been, like the soil has been, the gas seeped into the soil, and that can be causing problems. And I don't know if this is related to lead poisoning, but there's on Cold Road, I don't know if you all know about the graveyard, which is the old airplanes. Well, across more east, to the east is a big field, and it's been fenced off for years because they can't really do anything yet because the fuel from the airplanes seeped into the ground, and so the ground is considered contaminated, so they're not allowed to build anything there. Glazed pottery, of course, lead pipes, clothing, depend on where parents work, things like that, or old toys and furniture. So a lot of times parents save old toys from when they were kids or their grandparents, and that sometimes they can have lead paint on them. So you think about kids chew on toys, and so they're more at risk for getting lead poisoning. How they treat lead poisoning is really often it's chelation therapy, which is a removal of the heavy metals from the body, and that's either orally or IV. Aplastic anemia, so it's their bone marrow fails to produce cells, and they end up having a pancytopenia. So all of their platelets, their red blood cells, and white blood cells are decreased. So it's that type of anemia. It's usually congenital, and one of the ones that we hear of most is called Fanconi anemia. Excuse me. It's autosomal recessive, and it could, most cases are idiopathic, but it can be linked to environment, exposure, things like that. They will typically categorize it as severe or non-severe depending on the counts. And then how they treat it would be stem cell transplantation, and then immunosuppressive therapy if they can't match the stem cell. If it's not treated properly, they can have overwhelming infections, hemorrhage, and death. Sickle cell disease, we see this, a few kids with it. I think your first VSIM was about sickle cell. It's inherited. It's a disorder that affects about 2,000 newborns a year in the United States, which is pretty significant. Usually they're of African, Mediterranean, Middle Eastern, or Indian descent. And then there's a couple different types of a couple different things that are affected with sickle cell disease. Basically, the cells become almost like sickle shaped, and so when that happens, it clogs up the circulation. And so, as you can see, normal red blood cells are more rounded, and then these are sickles, so they will aggregate and cause blockage of blood, which means blockage of oxygen. They can cause strokes. They can have what's called a vaso-occlusive pain crisis, because anytime you have that type of blockage, you have an ischemia, and ischemia is painful. And so they'll have severe pain. They'll have to have their spleen removed because it's really not working. It affects their eyesight because there's decreased retinal flow. They can have ulcers that aren't healing, can cause gallstones, delayed puberty, priapism, and enuresis sometimes. So lots of different signs and symptoms we see with sickle cell disease. One of the biggest things with sickle cell disease is the pain that they have. A lot of times they're taking pain medications prophylactically at home. So when they come in the hospital in some type of a vaso-occlusive crisis or just severe pain, we want to get oxygen on them right away because they have decreased oxygen circulating. We want to get IV fluids into them, and we want to get pain medication into them. Over the years, I've seen people with sickle cell disease been accused of drug seeking because they are requiring higher levels of drugs than we are comfortable giving. Management really focuses on preventing those crises, so keeping them healthy and well, kind of a state of homeostasis, antibiotics, and immunizations for kids, prophylactic antibiotics if needed. Hydration is very, very important. And so sometimes kids do really well with sickle cell until they get some type of infection. They become dehydrated, which decreases circulating volume. There's a lot of research in this area, and we are screening newborns for sickle cell. It's a lot in 50 of the states right now. And of course, if there's any family history of it, they will screen them. So when we think about it is with the hemoglobin, it'll be somewhat lower. Their platelets are increased because of that, as you notice, that clumping of the cells. And their SED rate is elevated. They'll have abnormal liver function tests. And so really treating the symptoms is important, education, and then seeking any type of care for febrile illnesses, getting their vaccinations, like I said, getting too hot, too cold, too tired, and then noticing signs and symptoms like the child's pale, listless, abdominal pain, joint pain. Like I said, they have some severe pain, so sometimes we are treating them with high doses of opioids. Another one of the clotting disorders we see, and again, if I skip the clotting disorders, if I didn't mention them on the cells, you're not responsible for them. Those are things that we see in adults, or they're very rare. One of the things we see is idiopathic thrombocytopenia. And so it's an immune response typically follows some type of viral infection, and it produces antiplatelet antibodies. So these destroy the platelets, and then they lead to this purpura and petechiae, and those areas don't blanch anymore. So again, after a viral infection, sometimes we'll see the petechiae and the purpura. The purpura may look more solid. The petechiae is little tiny dots, so pinpoint hemorrhages. And then purpura is the larger areas because blood is collecting under that. One of the things with this is early intervention, and they will typically treat it with IVIG, and these kids are platelet transfusions that really usually aren't indicated unless there's severe bleeding, but these kids will be fine if they're treated for a couple weeks. They should be okay. Some signs and symptoms, if it notices that they start bleeding anywhere, so bloody noses, bruising, and like I said, the history would be, have they had a viral infection, so they feel it's an autoimmune disorder. Hemophilia is another one of the clotting disorders that we talk about. And so usually males have it. Mothers are carriers and males will get it. It's there's 3 different types, but typically we talk about type A. The The biggest thing with hemophilia, again, is just keeping them healthy. Preventing bleeding is important. So what they're lacking in type A is factor 8. So it's a factor 8 deficiency. If we think about that clotting cascade back in A&P, if you're missing anything in that clotting cascade, there's going to be some issues. So missing factor 8, they're not going to clot. The vessels will constrict when there's bleeding, and it will form like a plug made out of platelets, but there's not enough fibrin, so it will just continue to bleed. So sometimes we see them bleeding into the joints, and they'll have a lot of pain. Sometimes GI bleeds, things like that. So treating them with factor, giving them the factor that they're missing is what's needed. Parents are doing it at home, butterflying it in. Sometimes we see them in the hospital. They follow up at the clinic. At Banner, there's a hemophilia clinic, and so they're monitored. Basically, before surgery or anything that's going to be traumatic, they need to give prophylactic factor. Factor is very expensive. Anytime you have something manufactured that your body naturally makes or should make, it's going to be expensive. Years and years and years ago, we would give them the factor from blood transfusions. So the blood bank would extract the factor 8 from, say, 10 or 15 different units of blood that people had donated. Blood wasn't checked back then. So what happened was a lot of kids with hemophilia contracted HIV because that was not tested back then. So they ended up dying of HIV, not hemophilia. But now we check blood, plus it's synthetic. The factor now is synthetic. Psychosocial impact, obviously a huge one with any disease or chronic illness for the families and the patient. Getting them to the highest level of wellness is always a goal. And then sometimes there's some camps for kids with different types of illnesses, diseases, things like that. Leukemia. So leukemia is one of the most common cancers we see, and it's a bone marrow problem. What happens is the normal cells are being replaced by the abnormal ones. Usually we talk about lymphoblastic leukemia is where blasts, which are immature white blood cells, are taking up space in the circulation and pushing out the good blood cells. So if you have too many blasts, you're not going to be able to produce the marrow properly. It's kind of like having too many new grads on one shift, or too many nurses that are retiring on one shift, or too many residents on one shift. You have to have a mix. So it affects the blasts. Could be acute or chronic leukemia. Some of the complications of leukemia are metastasis, so spreading it to other sites like bones, blood, CNS, spleen, liver. But leukemia is one of the first cancers that has been said to be curable over the last 50 years. If a child has a recurrence of leukemia, then typically they have a poor prognosis. ALL, which is acute lymphoblastic leukemia, as we see mostly in kids, but they can achieve remission with this. And then again, the blasts are, the immature cells are pushing out the regular cells, and that's affecting the nutrients. So you'll see fatigue, weight loss, bruising. Bruising is one of the biggest signs. And then sometimes they can even develop joint pain, things like that. If it does spread to their CNS, then you're going to see signs of seizures, coma, changes in vision, things like that. And so any of those changes in behavior, personality, headache should be reported. They will do chemotherapy. And like I said, it has a good remission rate. Some of the signs are swollen lymph nodes, a fever, night sweats, nosebleeds, infections, bleeding easily. Sometimes we see bruising, but you need to look on areas other than typical bruising areas for kids. going to skip over some of the other types of lymphomas because we see those in adults. Brain tumors, so they're very common in kids, most common type of cancer. And prognosis really depends on where that tumor is and the staging of it. Those tumors have to come out because if they don't come out, then there's a risk of increased intracranial pressure, which we've talked about, and that could be an issue and problem. So you want to take that tumor out because it's taking up space in that skull, and the skull's not very forgiving of things in there. So when the tumor grows, it's putting pressure on the tissues, and then you're going to pretty soon have signs of increased intracranial pressure. Some kids have hydrocephalus, which is that fluid on the brain. We talked about a ventricular shunt, a peritoneal shunt they may put in. Typically, they don't use too much radiation. They'll use some chemo after they remove the tumor. Some of the signs of a brain tumor would be that headache, nausea, vomiting, maybe walking unsteady, so ataxia, seizures, not being able to swallow, irritability, so inconsolability, failure to thrive, or sometimes we see developmental delays with kids with brain tumors. A neuroblastoma is a tumor that arises. It's an embryonic tumor, and it typically is around the abdomen, specifically the adrenal glands. It can occur other places around the paraventricular chain in the chest and into the retroperitoneum. Typically, we see a tumor on the adrenal glands. One of the things with this type of tumor, they may see a swollen abdomen, and the Wilms or the neuroblastoma is typically, like I said, found in the stomach area, and usually we're seeing it in the smaller kids. And again, prognosis depends on how the staging of the tumor. So a couple more bone and soft tissue tumors. We see osteosarcoma, so osteo's bone. We sometimes see this in the growth spurts times of adolescence. We had a patient one time who was playing football, and he was a good-sized kid, 17, and was running down the field, nobody around him, it was just practice, and he just fell and had a spontaneous fracture of his leg. Well, that doesn't really happen unless there's a reason. What happened was he had an osteosarcoma there. It weakened the bone, and that's what happened. At some point, he would have noticed that or had pain, but sometimes that's the way we diagnose it. It used to be the treatment for osteosarcomas was amputation, but over the past probably 15, 20 years, we've been able to not go to that right away and do surgery. So debulking of the tumor. So if it's not treated, they can have metastasis and usually to the lungs and other bones. So surgical removal, again, when we talk about psychosocial, that's really hard. I mean, here's a football player we had, and he was fine, and all of a sudden now he has a tumor in his leg and probably won't play football again. So you have to think about things like that. A Ewing sarcoma is highly malignant bone tumor, and it's more rare than the osteosarcoma, but it can affect the chest wall, vertebrae, long bone, or pelvis, and treated the same as other types of tumors. Rhabdosarcoma is a soft tissue tumor, again, embryonic in nature. And it's highly malignant, and it'll spread via the venous and lymphatic system. So treatment is and prognosis is based on the staging. Surgical removal is usually the key for a Wilms tumor, or excuse me, a rhabdomyosarcoma, and the sometimes what kids will complain about is an asymptomatic mass, and then that is investigated. Any tumors that are around the airway need to be assessed quickly because they can affect their work of breathing and cause airway compromise. Your Wilms tumor is the most common renal tumor. We see it about 2 or 3 years old. Unknown causes, 90% chance of survival. One of the biggest things about the Wilms tumor is that you should never palpate it, because this one, if you're palpating that tumor and it breaks open, it'll have the seeding of that tumor will go all throughout the system. So I have to be really careful in this type. So basically, for any type of tumor in that area, you want to not be palpating too hard. And then retinoblastoma, so highly malignant tumor that comes from the embryonal retinal cells. It could be hereditary or non-hereditary. And basically, this white colored pupil. Should be very concerning if people see it. It's called a cat's eye reflex, or your book calls it a whitewash glow. And usually we talk about kids who have some inflammation. There's a family history of it, and sometimes they need to remove the eye if there is metastasis or if it's progressing. The progression has been severe. And that's it on this chapter.